The skin hosts arteries and veins which end just under the epidermis as tiny capillary loops. These loops are accompanied by vessels of the lymphatic system. Plasma is the fluid which is present within the blood. In the skin, it leaks out of the capillaries and then moves through the layers of the skin, providing oxygen and nutrients. Once in the skin, plasma is rebranded as interstitial fluid. As the interstitial fluid moves through the skin layers, it collects expired cells, degraded protein, microbes, and products of metabolism. This waste is then drained away from the skin in the lymph system, where interstitial fluid is then referred to as lymph. The layers under the epidermis can be likened to a bath holding water. The tissue is the bath itself. The capillaries are the taps, and the lymph vessels are the plug hole. In the taps, the fluid is referred to as plasma. In the bath, it is interstitial fluid. Down the plug hole, the fluid is lymph. Tissue swelling or edema can happen after injury, where it resolves after a few days. However, there are many causes for edema, and a diagnosis should always be sought, especially if the swelling does not subside. So why does edema take place? Edema happens when the bath overflows. The skin fills up with fluid, and if it cannot drain away fast enough, then it compensates by expanding. In the arms and legs, this retention of fluid will increase limb size, distort its shape, cause heavy-feeling arms or legs, reduce mobility, produce pain, and can increase the risk of infection. When seeking a diagnosis or a reason for edema, consideration needs to be given as to whether the cause originates as a tap or a plug hole problem. Are the taps running faster than the plug hole can drain the bath water away? This problem can be caused by things such as heart or kidney failure, medications, or damaged veins. Alternatively, edema can happen when the taps are working just right, but the plug hole is blocked and the bath water cannot drain away. Radiation, trauma, surgery, and infection can cause this type of swelling. A significant therapy for limb edema is the application of compression, which can be bandages, stockings, wraps, or pneumatic pumps. Compression is the only tool which is able to turn down the taps whilst also increasing drainage out of the plug hole. When confronted by limb swelling, determine whether the taps or the plug hole are the problem, and then consider compression as a priority intervention.